So ethanol ablation is a technique that we use to treat thyroid cysts. Thyroid cysts are spaces within the thyroid gland that are filled with fluid. And they can sometimes be quite large and create pressure symptoms for the patient, or a visible nodule or lump on their neck that they're self-conscious about. If we just take out the fluid with a needle, which is very effective in the short term, we can completely empty it and make it go away, but the vast majority will refill and reaccumulate within weeks to months, sometimes faster. So what we do with ethanol ablation is we take out the fluid the same way, but at the same time that we take out the fluid, once the fluid is out, we inject or instill into that space, into that cyst space, alcohol that is at a very high concentration, a high concentration alcohol that remains in the cyst and creates inflammation and scarring. That prevents the cyst fluid from reaccumulating. It's very effective. It doesn't work in everybody, but the vast majority of patients will do very well with that and either not reaccumulate at all or reaccumulate a very small volume of fluid in the cyst that is no longer a problem for them. So if somebody was to have surgery for a persisting or recurrent thyroid cyst, we would have to remove half their thyroid gland, which has implications in terms of their thyroid function long term, and it's an open surgery under general anesthetic. So if somebody has a pure thyroid cyst, I would strongly recommend that they try ethanol ablation first before even considering surgery. Most of the patients don't have any significant symptoms after, but as mentioned previously, if they do have a little bit more inflammation than the average patient, they might have some local discomfort that requires painkillers and sometimes some anti-inflammatory medication. But that's the exception. In terms of restrictions, some of these cysts can bleed into themselves. That's often how patients will present with these. So I would discourage the patient from doing strenuous physical activity for perhaps 3 or 4 days. Most patients, particularly if the cyst isn't that large, will respond well to one treatment of ethanol ablation. Sometimes the cyst will partially reaccumulate, but not to the extent that it was before, with a much smaller volume of fluid within it, and is no longer problematic for the patient, because really it's symptoms that we're treating. If they're not having symptoms, it doesn't matter that the cyst is partially there. Sometimes it reaccumulates to a point where they're still having some symptoms, and we'll repeat the ethanol ablation a few months later. If they've had biopsies of their thyroid before, this will be very mindful of a biopsy. They'll be lying on their back, the neck will be just cleaned. We'll look with an ultrasound and see exactly where the cyst is, and then just freeze the skin with a needle, the same way we do for a needle biopsy, in the region where the cyst is. And then using the ultrasound probe again to see exactly where the cyst is. Once they're well frozen, we'll introduce another needle and just aspirate or remove the fluid from their cyst. And then once the fluid is removed, we'll instill a small volume of high concentration alcohol. They won't feel much at all. Afterwards, sometimes we'll give them painkillers or anti-inflammatories, because the inflammation that the alcohol causes may cause some local discomfort in their neck. And that's usually well managed with standard painkillers.